Hello, I'm Dr. Robert Hardesty, a board-certified plastic surgeon practicing here in Riverside, California. Today's topic is malposition of breast implants after surgery. What one person's malposition can be another person's desire. For instance, I'll have patients come in and say, I am paying for this breast augmentation and I want everybody to know about it. I want them to sit under my clavicles or collarbone and to be round and firm. I have others that will say, I want it very natural, I want it low and into a teardrop position. So what's most important is that you clarify with your plastic surgeons your desires. So, and how do we do this? We have you get 3 to 4 nude photos that we can use as models that during the surgery we can place the implant. However, sometimes things happen. For instance, in the early period, especially with the subpectoral breast augmentation, the implants are placed perfectly where they should be. But as you awake from surgery, the natural action of the pectoralis major muscle is to push them up and out. And we want them down and in most of the time. So how do we do that? In the early period, we'll have you do the 5-5-5 exercise. 5 minutes a day, 5 times a day for 5 weeks, where we'll take the implants and we'll have you push the implants inward or downward or upward, depending on where you want them to sit. Now, what happens? Sometimes in this early period, they stayed laterally or out to the side. So how do we treat that? Wire bra or actually tape the implants as the capsule's forming? If they're sitting too high and won't come down, we'll use a breast strap. And that looks like this. This has Velcro on it. It goes around the breast and you wear it 24/7 to help push the implants down. We also do what we call the table exercise, where we have you bend over and on the upper pole of your breast, on the edge of a table, using your thighs, push forward. That will drive the implants down lower. Now, what about if they're inferior or they've gone too low? Well, we'll put you into a wire bra, we'll tape you, and then we'll use a shoestring as an external splint. So, depending on where your breast wants to sit, we'll put the shoestring and it provides an external splint under the inframammary fold or your breast crease to hold the implant where we want it to be. We'll also occasionally tape what happens. Tape the implant. Now what happens if it becomes too close and you get what's the start of a synmastia or this starts to lift? Well, we have another special device, and that device is called the T-bra. And let me tell you how this T-bra works. It looks like this. It has a firm backing. It sits here and the breasts are here and here, and it holds the tissue down so you don't get the unibreast bread loaf deformity. One breast, 2 nipples. We want the curvature. Okay, what happens if now we can't get this into position, usually after the 6 to 8 week period? Okay, we now call this the latter part. Depending on where the breast implant is, for instance, if it's sitting too high, we can go back in, and a lot of times just do this under local, do a capsulectomy. The breast implant sits in a capsule, the scar tissue. What we do is we just make a cut in that scar tissue and the implant falls to the position that we want. What if it's too low? Well, we can do a capsulorrhaphy. So here's the pocket, the implant sits too low, we'll go ahead and bring the implant up and close the pocket. That's called a capsulorrhaphy. That's usually used when it falls too low or it goes to the side. Now, in some cases, when it goes centrally, a synmastia, it pops off, we'll close that with a capsulorrhaphy, that's closing the capsule, but we need to add extra tissue, and that's called acellular dermal matrix. This is a matrix. It can be of human origin, porcine, or it can be a bovine extraction. This is chemically treated so that it's sterile and that only the matrix is there. So we use this as a backing or a bolster internally and sew to that. So like if it's too low, we can use it as a hammock. If we want to sew it down here, we can give it extra material like you're trying to reinforce a garment. Now the body looks at this acellular dermal matrix and goes ahead and dissolves it, but replaces it with your own tissue. It's been widely used in breast reconstruction, and if need be, we can use it in cosmetic surgery as well. So, in summary, malposition can be a matter of opinion. Sitting too high, sitting too low, sitting too centrally, sitting too laterally. The most important thing is to treat it early. With early treatment and attention to detail during surgery, we can hopefully prevent it or treat it without surgery. In the later time, surgery may be necessary by doing a capsulorrhaphy, suturing the capsule, capsulectomy, removing the capsule, or then substantiating it with acellular dermal matrix. Thank you very much.